King's A&E.
Lovely. Cheers, bye.
Adult trauma call, 8 minutes. Adult trauma call, 8 minutes.
I've got an unconscious gentleman. He has severe traumatic brain injury.
King's College Hospital, London.
I think something hurt.
One of the busiest A&E departments in the country.
They're a bit busy right now. Maybe 20 minutes, 30 minutes.
King's is extreme, isn't it? Come on.
A place where love, life, and death unfold every single day.
Fall from a tree. It's probably absolutely trolleyed.
I'm very drunk.
I just keep thinking, how am I going to cope?
All the patients you're about to see were treated in one department in just one 24-hour period.
Camino. Everyone should walk through an emergency room at least once in their life because it makes you realise what your priorities are. It's not the rush, rush, rush and the money, money, money. It's the people you love and the fact that 1 minute they might be there and 1 minute they might be gone.
I will do assess for number 4 if you want me, because Maria's doing this one. Yeah.
Every day, King's A&E treats patients with anything from a cut finger to life-threatening illnesses. For the staff, it's a daily encounter with all aspects of society.
It's quite interesting being in this bay because you can see so much going on.
Definitely in A&E, you learn the nice things and you learn the harsh things of life. Like you learn there are people out there that really have no respect for other people. They're just out for themselves. And then you see the nicer side of people. Like, you know, they're going through a really bad time and they're still considerate of you, of other people around, and sorry to be in the way, sorry to be of trouble. And you're like, you know, you're the reason why we're here.
Hello.
Hello.
This one smells good.
Oh, shall I move?
You're very well, thank you. Considering.
Well, you're not very well. You wouldn't be here otherwise.
If you're well enough, you're not here.
No.
We got you.
Silly question, isn't it?
You've got to say you're very well, haven't you? Even if you're not. You've got to be optimistic.
74-year-old Ted and his wife Irene are on their 10th visit to A&E this year.
You are Mr. Ted.
That's right.
Just short for Edward.
Short for Edward.
Yeah, my name is Edward.
Oh, right.
Oh, two Edwards together.
And this is your lovely wife, is it?
Yes. Thank you for that compliment. We were next door neighbours, really, and sort of it stemmed from that. We used to go to work together on the same train, and that's how things developed. He would meet me for a drink and that, and then a couple of times when we were coming home, because we used to come home on the same train, he used to hold my hand, and I thought, oh, he's just being, you know, just neighbourly sort of thing, but not realising what he was possibly suggesting.
You all right? Hi, Ted. It's all right if I call you Ted.
Yeah.
And I'm Maria. Just find out what brought you in here today.
Well, I've got a cancerous tumour in my bladder.
In your
Bladder.
bladder, okay.
And basically it's terminal. So.
Okay. Are they going to do any treatment? Are they going to work you up for chemo here, or?
No, the chemo's no good.
No good. Have you had chemo?
No. But what they said, it's no good for the bladder.
So what brought you here today?
Well, my GP took some bloods earlier in the week, and then when I went to Guy's yesterday, they did some more blood tests, and about 11 o'clock last night, they rang me and said, it's got worse. We suggest you get yourself into King's.
Oh, my goodness. OK. Well, listen, what I'm going to do now is I'm going to do a set of obs. I'll attach it to the monitor. I'll get some bloods off on you. I'll make sure that bag of fluid is going through. We'll test your urine and we'll get you a cup of tea. All right? OK.
Fair enough to the doctor. He said, we can never say it will be this, it will be that. We can only give you an approximate time. Might be a little bit less, it might be quite a bit longer. He said, but I'd say a year, 18 months.
So we just make the most of what we've got left, which I intend enjoying, so.
That is a fantastic attitude.
And
Well, let's see if we can get these problems sorted out.
yeah,
And then...
I feel sure you will, because I had a very similar thing in the summer. And
is it difficult not to get attached to some of these people that you treat?
In general, I don't want to sound hard, but in general, no, it's not. And that's just the nature of A&E. You're not nursing a ward of patients. It's transient, it's continuous, and you have to move with it.
getting very hot.
Yeah, it is actually. You can do me as well.
Ecstasy.
Oh, lovely.
Oh, God, can you just stop hurting, please? Just for a second, just be like, you know, be cool. Silly leg. Silly leg.
A drunken night out has left Ian with a broken ankle.
Hiya. My name's
Hey.
Jess. Hi.
Sorry, what's your name?
Jess, hi.
Jess, nice to meet you, Jess.
Nice
Ian.
to meet you. So, what were you doing?
I feel like such an idiot again. Yes, I was skateboarding.
What time in the morning?
Yeah. 3:30. Well drunk, yes, Jess. Yes.
Okay.
Okay, it's as ridiculous as it sounds, and yes, I
Is
feel
it the ankle or
yes, it's
the knee?
entirely in the ankle. And there's just a bit of bruising. I scratched my knee, so it's fine. Yeah. It hurts when I stand on it. Yeah.
Where were you skateboarding? Down some stairs? Or?
Well, no, between God, just going down the shops to pick some more beers, which is sensible. Yeah, that's pretty sore.
What about there? Okay. I'll grab an X-ray and we'll go for it.
Sorry for wasting your time.
Oh my God, no, don't worry.
Oh.
Kevino. All right, I'll just get everything ready. I can see you're not scared of needles or them tattoos. Oh, can I borrow a piece of your tape, sir, please? It's a good place to keep it there. Thanks. I finished. Yeah.
When she's on shift, nurse technician Amanda takes blood, inserts drips, and attends all trauma calls.
Once I take this off, my uniform off, I'm the same as you. Well, I'm the same underneath it. It's just, I like doing things for other people. That's what makes me happy. If I was to do things for myself, they'd never get done. But if I was to do it for you, you'd be done like that. I'm not going to smoke today. Let's see how long it lasts. A lot of the ambulance guys call me Peggy Mitchell. Hello. Barbara Windsor. I've not got the assets though, but never mind.
A 40-year-old man has been kicked in the face whilst playing football.
We're just going to get you over onto this trolley, all right? I'm Amanda, this is Emily. Can you shuffle over, mate? We're going to need to get you undressed, and we'll just sit your trolley up a bit. And then we'll move your trolley over to the monitor. Going to need to shave a little bit of that chest, mate.
This is 40-year-old Drunken.
Yep.
He was playing football and had think he went for a tackle and the start of the other player went into his face.
Thank you very much. Oh, don't worry, Duncan, we'll get you fixed up. What I'm going to do is pop a cannula in. It's a thin tube, it'll get left in your vein until you go, and it's just in case you need to have some further treatment, some painkillers or anything that you might require, and you don't need any more needles. So can I have your arm? You pop it nice and straight. What position was you playing in? Oh! Should have been a goalkeeper.
Should have been a stop.
Sharp scratch. Excellent. Lovely veins, Duncan. Makes my job a hell of a lot easier. I just wanted to ask you, Duncan, what was your surname?
Anderson.
Anderson, lovely, I got that. Well done. Well, you want to eat one of those Cadbury's Bliss? I had one last night, the new one. Oh, yeah. Peeled the chocolate, got the inside, you know, because it was so nice, you just want to savour every minute of it. And that was my treat to myself last night, was one of those.
Can I tempt you with a banana? Don't fancy the orange? So you haven't got a temperature?
No. I'm getting bored now.
Have you got a fluid chart, honey?
I don't think it's actually going.
No, I don't think it is.
Maria?
Maria? Yes, dear.
It's actually dripping.
Is it not? Let me get a flush and sort it out.
It's all right to call you, isn't it? We never know.
Jakers.
Thank you. Times I tell him.
I do the exact same, actually. Well, I started training 20 years ago. God, 20 years. I suppose, like an awful lot of other people that go nursing, kind of very idealistic. Not that you cared more, but you were a lot softer in the way that you looked at things, I expect. Yeah, things affected you differently. Like, everything was wow and oh my God and poor them kind of thing, I suppose. Is he okay?
It was okay, but I couldn't get it down.
Mm-hmm. Mine was all right.
Was it okay?
Yes.
Right.
He's a very gentle person, and like he likes his art, but he sort of introduced me to art, and I thoroughly enjoyed it. We love going out for walks. I think your tummy's a bit swollen to normal. We're companions to one another. You know, we just sort of clicked. It was just strange, really. You just felt, oh yes, this is the person I'd like to be with for the rest of my life.
Come here.
Just put your head up a minute. I'm just going to support your head a little bit, all right? All right?
God's sake, bloody leg.
A&E minus.
We're gonna do the blood, yeah? Extraction. Take the blood, put the needle here.
I fucking hate needles.
Huh?
I hate needles.
Yeah. If you, I'm telling you, if you...
Let's just not talk about this, I'll deal with it when it comes along, you know?
Yeah?
Yep. Ignorance is bliss.
You got a good pen here. Okay. You've got a very, very good pen.
Thank you very much. Let's, Cheers, pal. Oh,
Painkillers.
fantastic, thank you.
With a sip of water.
Am I allowed any more water, is that it?
Yeah, just a sip.
I'm pretty thirsty.
Okay, yeah.
Well.
Taking more medication and then having a little...
Oh no, let's not do this, come on. And we'll do this another time. Should we do this tomorrow?
No.
Tomorrow's a good day.
You're going to operation theatre. And then
Let's do this after the operation, though. When you know.
No.
Yeah.
They're going to give you anesthetic there. So
I know. I'm
you
just.
don't
I'm
escape.
just.
You're a big man.
I just hate needles, man.
Okay. How many balls
Give me a bowl full of cockroaches. Just no needles.
How many? What did you drink last night? If you drink, you're not allowed to do skating, yeah?
Come on, man. Like.
I'm sorry for mess, yeah? The blood is on the floor.
It's cool, man. It's cool. Joy of joys.
All I need is going home. So.
Oh, that's a lot of blood.
Yeah.
Did you have to make such a mess? Come on, man.
Well, the thing is,
You said you've been doing this for 20 years. Look at this.
Yeah, but this is unavoidable. You're so active.
I'm sorry.
It's not my
You're
fault.
wasting my precious blood.
I know. Okay.
These are my favourite jeans.
Hmm?
Is there any chance I can get an iPhone charger?
My name is Kevin Hillman and I'm a porter. We're actually on the front line of A&E. I've seen stabbings, I've seen shootings, I've seen people with dislocated shoulders, broken legs. So we are the most important department in the whole hospital at the moment because they're coming in 24/7.
And on the way, can you bring him to X-ray?
There's another porter sitting down in there.
Well.
Sometimes it can be difficult. You just have to be focused and concentrate and just get on with the jobs, what they ask you to do, mainly. But they're doing chicken and chips for £1.99 and the chicken shop.
Much money. Where's the money? So rent is going to...
Can we have a porter to X-ray, please? It's a porter to X-ray, thank you.
I quite enjoy it. I've got friends here. I know some of the doctors. I know some of the nurses. I'll get on well with them all.
Kev, I'll treat you to a little coffee later.
No, that's all right. Don't worry about it.
No, you bought me one. I'll have to return the favour.
Just get me a Red Bull later.
All right, I'll get you a Red Bull because I'm going to need a Red Bull.
You can fix it, don't worry.
Oh, it's not as bad as I thought it is. Okay?
Okay, good.
It's not as through as I thought.
Okay.
Your tooth might be quite sore because it's probably...
It's all bruised, and yeah, no. As I consider myself very lucky. Hello? Put it this way, when I talk, I can feel my top lip flapping around from just below the nose. but just tell Jonesy and John that I'll still be prettier than them.
Adult red phone 6 minutes, adult red phone 6 minutes.
Indy, was that an adult red phone?
There was there's a cardiac arrest and there's a peds trauma.
A patient has arrived, having suffered a heart attack.
Any change of rhythm? Has it been PA throughout? Okay.
Amanda is a key part of the team administering CPR.
Do you feel any pulse? I can't feel a pulse. Okay, that's PA. Can we continue CPR, please, and give some adrenaline as soon as access is secured?
Adrenaline going in.
Thank you very much. 12 minutes past was the first adrenaline, so...
You sure you don't want another line? The minute it arrives, it affects me. The minute it's in the door, it affects me. Because I know, you know, potentially they're not going to survive. So, but, you know, it does affect me a lot. Is that going, Dave?
How long has that been?
Do another cycle, please, thank you.
Go.
You had one last cycle. You had, she had there, yeah?
I just think, let's get, you know, let's try and get them back.
With that in mind, so PA. Should we do one more cycle and then if there's nothing from there?
Well, I think we're doing a pulse check now. I think there's no pulse.
Thanks very much, Simon. Thank you.
It's only afterwards that you sort of put the picture together of the person. It's when I go home that, you know, and I'm on my own sometimes. That's when you might have a little cry or release, but not when I'm at work. You know, you could have had one situation where someone's died or, you know, there's a major trauma and then 10 minutes later you've got the same situation again. So you have to be professional and it is hard.
Amanda.
Kevin, did you get your...
Yeah, did he make it? No.
Every year, 7 million people have accidents at work.
Nikolai Koichev, please.
So are you a doctor?
Nikolai, a builder, is one of them.
I was 4 hours here.
We're super busy today. Usually, when you wait very long, it means you are not super urgent.
That was...
But it looks nasty, I agree.
What happened?
Cut the finger with chainsaw.
Oh, nice.
Very nice.
Okay, the X-ray does look quite alright.
Yeah.
The bones are not injured. We have to check that the tendons are right.
So you can save it?
Yes, I'm pretty sure, yeah.
Very painful.
Okay, good, you're very brave. And it was a chainsaw?
Hedge trimmer.
How do you call it?
Hedge trimmer.
A hedge trimmer, okay.
Are you British?
No, I'm German.
What are you doing here?
Decoration, you know, just look good and
Why
walk
not
around.
in Germany?
It's good work here.
Better money here.
Yeah, as well.
I saw in Germany is better.
I mean, you came here as well, isn't it?
Yeah.
My job as a foreigner is as well to adapt to national habits.
Do you like football?
Yeah, very much.
Do you know Balakov?
Yeah.
He was playing in
He played in Stuttgart, isn't he?
He's Bulgarian, yeah.
I got the hint, for example, from nurses that you can't say this or that straight to a patient. Even if it's just a small thing, like give me your arm, I have to take your blood. You should imply a little bit more, darling, please, would you mind? Unfortunately, I have to. I know it will hurt a little bit. The German way is see the problem, make it known, and solve it. Will it hurt, doctor? Yes.
How long are you working in here?
3 months now. And there before I worked in Africa.
Oh, yeah?
Yeah. It was like here. You can get shot outside.
How old are you?
33.
Are you married?
No.
Cute?
Cute?
With girls wanting you?
Single at the moment, let's say that way.
Tadeusz Bros.
Yeah, hi.
Okay, take it easy. Sorry, yeah, okay. Yeah, I got splinter in my thumb. Okay, let's have a quick look. Yeah, but it's not very fresh. I got it like, I don't know, it's hard to say, 1 month ago or something like that.
A month ago.
And there was like hard skin build around it.
Okay, and what's made you come in this morning then?
Nothing special. I went to Peckham walk-in clinic first, and they said, no, we can't. And they sent me here. It's nothing special. I really just realized it's not gonna come off naturally, so
okay,
I need to someone to take it off, I'm afraid.
Okay, grab a seat back out there. Listen for your name. Doctor will call it through that door, and we'll have a look at that for you.
Cool, thank you.
I've just tried somebody who's got a splinter in his thumb for a month.
Doctors are trying to establish why Ted's kidneys aren't functioning.
And again. How long have your kidneys not been working very well?
I had again in June when I was in, and I had a
Can I interrupt?
Yes.
12th of May, he had acute renal failure. Do you want that?
Could I borrow this? I promise I'll bring all this stuff back to you.
No, you can keep that. Yes.
And this. I'm just going to write some things down. Just make a sort of plan of what I want to do with you. I'm going to try and admit you, basically. And I think you need IV antibiotics. All right.
Thank you.
That's all right.
I didn't do an ECG. I don't think she needs one.
Well, he doesn't think it's anything serious, does he? It is a very worrying time, and you try and put to the back of your mind what might be. You've always got, no, we're going to succeed, we're going to beat this. You mustn't think, oh, you know, this might happen, that might happen. You've got to be positive all the time.
Mr. Peacock?
Yeah.
Hi, I've spoken with my colleagues, the waterworks doctors, and they will take you in, and they're probably going to try and arrange a scan for you, whether that's a ultrasound scan or a CT scan over the weekend, just to figure out what's going on. We'll try and get to the bottom of it, but they're the best ones to deal with it. Is that okay? And that's kind of my involvement over now. Yeah. All right, but I'm sure.
Thank you very much.
I'm sure they'll look after you well.
Thank you for all you've done.
All right, you're welcome.
So if they're going to start doing ultrasounds or CT scans, they obviously think there's something there.
Well, there obviously is, isn't there?
I hope it hasn't spread somewhere else.
Well, it's a good thing you're here and not at home and wondering, isn't it?
Getting me worried now. Right, I'm going on in a few weeks, I don't know, a few months.
Okay, what happened?
Yeah, around 1 month ago, I'm not sure, but it was like a while ago.
Yeah.
I got a splinter in my...
1 month ago, my friend.
Around, yeah.
Yeah. You know what?
Yeah.
Go to GP, okay?
Yeah, really?
Yeah.
I went to GP today, and they sent me here.
No. That's
Really?
GP. That's GP thing, obviously. Look, it's 1 month, okay? So it's not urgent.
In Peckham walking,
Yeah,
she said, I can't do that.
Okay. but your GP can make you an appointment for surgeons if he wants to, because I
have no time.
Yeah, exactly, because you're not in emergency.
All right, cool. Yeah, it's fine.
Sorry for that.
That's all right.
Okay,
cool.
Alan has brought in his 77-year-old mother, Peggy. She's been attacked by a pit bull and broken her arm.
He's insured. I'm going to get into a solicitor on Monday, and I'm going to sue him for breaking her arm.
they took my coat away where the dog was trying.
Because the dog attacked this. When I came back and saw her, and I came with my dog for a walk, there was all like mouth bites all over it, like where the dog had been trying to bite her attacker. So the police took this away, and they done saliva test, must have took the saliva off it and put it in a bottle and sent it off. Is there any way my mum could get a wheelchair at the hospital? We lend it to her, loaned, or... Yeah, go home with her, get her about like... Right, tell mate.
So tell me once more what happened.
I was attacked by a dog.
Okay, and it was this morning?
Yes, I was going to pay me poll tax.
Okay, yeah. And the dog didn't bite you?
No, but he went to bite me. I was on the floor and he was pulling me coat, trying to get to my arms and my legs. Well, I mean, the 2 breaks in a couple of weeks.
What happened to your other arm? So this,
I slipped
this
it.
one happened today and this one is new, isn't it?
Yeah.
The more the people are in pain, the more serious, let's say, the injuries are, the less they complain and just say, doctor, do what you have to do. Especially the older ones, I guess, having suffered from the war.
Have you had this one in the cast? Yeah? Is it still on?
And you wanted to have it symmetrically, so you went searching for a dog.
Do the 2 legs next.
Yeah, I think she'd like to come up to the hospital.
Next one is free.
He's going to prod that in a minute. Start prodding it.
Okay, and I already can hear it snapping. That's very good. So we moved it. Yeah. Are you all right? Okay.
I was painted this.
I stepped on a nail and it went into my foot.
Oh, thank you, Jesus. Thank you.
Yeah, buddy. But I am refusing to put money on that vending machine, but I'm refusing to pay 70 pence for a pair of sneakers, but I'm tempted though, fam. I am so tempted. I just keep looking at the bar of sneakers and thinking, yeah, that money will do me good. Just go in there, just get it. It's like, just, I could feel the coins in the pocket as well, but I'm hungry and I'm tired. And I need a nice little long bar. So, any chance I can have some headache tablet? My head's really banging.
Do you just take the seat in cubicle 6?
No, wrong way. Oh, let's just do it.
Okay, well done. You're very brave. You're doing very well.
Oh, Jesus Christ.
Seems deeper than what I thought.
Don't say stitches, please do not say stitches.
Are you not happy to go for stitches?
No, I'm not happy with stitches. I'm being serious. I do not like needles in any way, shape or form.
Gluing is not a problem. We can do the gluing.
Yeah?
But it might leave a scar over there.
That's fine. I'll take that, but I do not
Yeah.
want needles. I know I'm a big lad, but still, when it comes to stuff like that, I'm a wuss.
I know, okay. But I'll need to have a forceps for that. Okay.
Does it look bad?
It looks much better than I thought.
Gonna make me look hard.
A little bit, yes. That's only concern.
Hello, it's Sharon.
How many beds have you got round there? 3? Brilliant. Fabulous. Fabulous.
Saturday evening.
Hello, King's A&E.
Sharon is the senior sister in charge of resus, the department where the most seriously injured or ill are treated.
I sometimes do think, oh, why didn't I work in a bank or something and earn loads and loads of money and be jetting off around the world and having a jolly nice time, but I'd probably be a bit bored. Hello, King's A&E. All right, thank you. Adult red phone in 5 minutes. Because turnover's so fast and you are running round doing so much for so many different people, and it does all merge into one a bit. Oh my God, this is ridiculous. Hello, King's A&E. Fall from a tree, 25 foot. It's probably absolutely trolleyed, I'd imagine, if it was up a tree.
Oh, right, here we go. Hello.
I'm never going to get a break now, am I?
It's a request for a whole-body CT. A 20-year-old male patient fell 25 feet out of a tree onto rough ground. Possible loss of consciousness at scene.
I'm going to put a finger in your back passage. You have to tell me if you can feel, okay?
Thank you.
CNN.
Stuart. Okay, Stuart, how's the pain getting on? Okay. So what were you doing up the tree, dare I ask?
Can you remember?
I don't know. You don't know? Do you remember falling out of the tree at all? No. Oh, right, okay.
He was up there cutting branches for the bonfire, weren't you?
I see. So where's the most pain at the moment? In your back, in your tummy, or in your legs?
In my spine.
In your spine. All right, okie dokie.
I like to live life on the edge. If life's a breeze, then it's not really that entertaining for me. I have to be dangerous sometimes to feel like I'm living, basically.
Don't tell my mum.
I'm going to tell your mum when I know what's wrong with you. Yes, I am. I'm not going to not tell her.
Don't worry.
I don't care.
Don't tell her.
No, I have to tell her.
How far I fall from?
How far? About 40 foot. I can describe Stuart in one word: stupid.
What was I doing?
Exactly. What the hell was you doing? Because this is the stupid things you do when you have a drink. Isn't it?
Ted is waiting for a bed on a ward so doctors can carry out further tests.
Actually, Debbie, will you throw me in a piece of gauze off the IV trolley? Debbie, will you throw me in a piece of gauze off the IV trolley? A piece of gauze off the IV trolley.
Oh, I heard you.
You're right beside me. She's a bit mutt and Jeff anyway. The best of times.
I don't know, what is it about people like that make you instantly like them? And I think it was that, you know, you walked in, he was very polite, and just that he was so positive, and that came through, and it wasn't false, he was really genuine, and you felt that from the time he started speaking.
Where's your wife gone?
She's gone home.
Is she?
Well, we've got a disabled daughter. And
Oh, have you?
yeah, she's got MS.
MS. She lives with you?
Yeah.
God, you have a lot of stress, haven't you?
Yeah, she's had it. She's 29. She's had it since she was 17.
And how is she with the MS?
Got worse.
Has it?
But, her walking's very poor, and her eyes is the other thing. She's really so partially sighted. Anyway, I think she does pretty well. She don't do too badly, really. But, she is a worry. And then I'm a bigger worry now. So.
Well, we have to get you sorted out, don't we?
Yeah.
Get you home.
neither of us were too worried. We knew he'd probably be feeling fairly poorly, obviously, but as in the past, they gave him these intravenous things, and in the end, everything turned out all right. So we weren't over-worried. We were worried that the infection had flared up again and wondered why.
And we're ready.
Jolly good.
Do you want me to chop?
Can you just push that bag round so it don't fall off? Lovely.
But that's it, isn't it? That's A&E for you in a nutshell. Like, you know, you can have people spitting at you, swearing at you 1 minute, and then you've got the likes of Ted and his wife coming in. You know, you don't always get the privilege of spending that time with them.
Take your hands in now there.
Oh, yes. I'll get a slap.
Thank you, George. OK, we're just going to wait for the results of the scan now.
There's not a lot, really, that happens that I've not seen anymore, and it has to be something pretty awful. You know, a lot of the time I walk out the door, I close the door behind me, and that's it, done. Then, you know, I'm out of work then. I'll be thinking about other things that are going on in my life, and you can't take it home, all of it home with you. You just can't.
I've got no answer for it. And because you're silly, you drink too much and do stupid things. And you don't listen to me.
It's stupid to go up there, knowing that I was drunk as well. I regret it now, because now I've got to live with what happened. People keep telling me not to go in trees again, and I probably won't be going in no trees.
Permanent damage, have you? Is that what you're asking me? You broke 2 ribs. And you've broken 2 veins in your spine. You're very lucky, you know. You get tired out talking, don't you?
You can do, yeah.
Well, you do,
Yeah.
you can tell.
You do. So,
But you've got to stay positive. We all got to stay positive.
well, that's what I try to do.
We did grow closer and closer as time went on. You know, things that you thought were very important first of all, not so much later on. You know, we were companions, we were husband and wife, we were soulmates, as they say. It's so difficult to try and explain how you really feel. You know, you just, oh, I do miss him.
Did you say she was with him? Oh no. He only died tonight at 11:15. Fuck, why didn't I go up? They didn't know whether it was pre or post. He had bladder CA and he'd been to Guy's and he was just a champion. Sorry, it's just 6 in the morning. But he really had a great attitude and he had a 29-year-old daughter with MS. And he was like, you know, adamant he was going to survive. There is patients that will get you, and there's probably 4 patients that I'll remember like Ted. For him to have such a positive outlook, and it can't but inspire you. But yeah, there are people like Ted, and there's a few Teds in my career that I will always remember.
King's A&E, can I help you? 16-year-old query stroke.
16-year-old query stroke?
Yeah. 16?
Wow, I had stroke.
I think an A&E department deals with people in every aspect.
She says she's suicidal and she has a history of 74 previous suicide attempts.
It's a place where they can come when things are out of control and they need somebody to look after them.